Hey guys, welcome back to my channel. I have taken such a long break. I have been so busy, and honestly my surgery has just been number one on my mind. Lots of things going on, lots of other things in life, my daughter's birthday party, and just all kinds of things that have been going on. And really I didn't have that many updates to give you guys, but I do now. I have a lot of updates, and I'm going to just make this my pretty quick update video for you guys. I'm going to update you on how my sleep study went, and that I have a whole other video for about how that process was. It was the at-home sleep study, so if you haven't watched that video, that would be a good one to go check out first. But I will give you guys the update on my at-home sleep study. I'm going to let you know what my surgery date is and how my last pre-op appointment went with my nurse practitioner. So I'm really excited to give you guys these updates, so let's just jump right in. Okay, first of all, my sleep study. I did the at-home sleep study, which I was very thankful to get to do the at-home sleep study. Again, I did a whole video on that. Go check that out if you haven't watched that already. I even showed the kit and everything about how that works. I know a lot of surgeons are doing that, or a lot of doctors are doing that in general. If you're coming up on that experience of your own, if you want to know a little bit about how it went for me, I have a whole video on that. But I did get my sleep study results in. I didn't, from the point of my sleep study till my appointment with the nurse practitioner, which I actually did delay on my end for a little, maybe 2 or 3 weeks from the appointment date that they wanted to give me, but it was a good, I want to say around 2 months, maybe not that long, but it was around that time that it took for me to finish my sleep study for them to get me my appointment. So I'm thinking in my mind, okay, if I have sleep apnea, surely we wouldn't go this long without getting me those results if I do have sleep apnea. So I started doubting the fact that I had it, even though I wouldn't have really been surprised if I had sleep apnea, just based on just being overweight. I really don't, my husband said I don't really snore that much. He's never noticed me gasping for breath in the middle of the night, things like that. But just based on the fact of being overweight, it wouldn't have shocked me if I had been diagnosed with sleep apnea. And come to find out, the nurse practitioner that I met with, she said that I did have mild sleep apnea. It really was mild. It was even kind of in the middle range of the mild spectrum. I don't know how, it's hard to explain, but it really was just mild sleep apnea. And because my surgery was so close, I chose not to get a CPAP. There was even a dental plate that she said I could order for maybe around $100, and it would hold my bottom jaw forward a little bit and it would kind of clear that airway and prevent the obstructive sleep apnea. I chose not to do that either, just because my surgery was so close. I know I'm going to be losing this weight, and then 12 months post-op, I will, for my surgery of course, I will have another sleep study, and if I still have sleep apnea of any kind, then I will get a CPAP. But I called for the price. It was just outrageous with my insurance, so I thought I'm just gonna wait and see what happens after surgery. So if you guys have any more questions about that sleep study, please let me know. I'm happy to answer any questions. So next is my surgery date. I got my surgery date a little while ago. It is officially August 28th. I'm gonna try to get this video posted today, which is the day I'm recording it, August 20th. And so it will be a week from tomorrow if I can get it posted on August 20th. So officially today, as of tomorrow, it will be a week away. So August 28th is the day. This whole process, I made this decision on March 31st. It was when I had my appointment with my nurse practitioner at my primary care physician's office, and I asked her opinion, and that's the day that I made the decision, was March 31st. So March 31st to August 20th, which is today, and it seems like it took forever to get here, but now that it's here, it's like, how did this get here so fast? Am I really about to do this? So it's something I'm so excited about. I really am, and I'm so proud of myself for making this decision, because it is a big decision, but it's one that I knew that I had to do for myself to actually really lose weight. It's tough. I mean, it really is tough. And I'm in the middle of my 2-week pre-op diet, which I'm going to do a whole video on that, because that is definitely a whole video's worth of information. But I'm going to show you what I eat in a day. I'm going to tell you how much weight I've lost so far. I'm right in the middle of it, and tell you about my struggles. And I'll tell you, there's been a lot of struggles. I mean, I think this is the hardest part so far. So I'll talk more about that in my next video. Definitely stay tuned for that, probably over the next couple days, and I'll let you know how that's going. I got a lot of great information. I had to go to a diet class, and it was about 4 hours. About half of it was with the nutritionist and or dietitian, and then the other half was with the nurse, one of the nurses in the office of one of the surgeons. And so it was very, very useful information. They gave us lots of packets, lots of you know, paperwork to keep for ourselves. I think I said this in probably all of my videos, but especially if you watch that very first announcement that I'm having gastric bypass surgery, I said that I was so impressed with my surgeon with the first impression, and that has not changed. His office has been nothing but incredible. And during my pre-op visit, pretty recently, one of the nurses that is a whole separate entity from them, she works for the hospital in the surgery department. I was there for a chest x-ray and an EKG, and she was so sweet, first of all, but she said that they were all really impressed with my surgeon's office, that they were so thorough, and they're just so thorough. They take the time to make sure you know this information. I don't feel like if I have any questions afterwards, there may be a few questions. I can't even see myself having any questions because they just cover it all. So I'm really appreciative of that. I got this whole packet. It's just got a bunch of information in it, but what I want to show you guys, or what I want to go over, is what they told me during my pre-op appointment. I had a lot of lab work done. All my vitamin levels were great. My vitamin D was the only vitamin that was deficient before all of this, and it was less than 20, I believe. So then I started taking vitamin D 3 times a week. I think it was 50,000 units, I'm not sure, or vitamin D3, something like that, 3 times a week, and now it is above 120, so it was way too high, so I had to stop that. But all my other levels were perfect. My lab work was great, so it's nice going into surgery knowing that I don't have any deficiencies with my lab or with my vitamins, because I know it's a lot harder after surgery to control that. So I met with my nurse practitioner. We reviewed the last little bits. We reviewed which medications to take. I know after surgery, for at least the first month, I can't take any medication that's bigger than the tip of my pinky. We went over all the medications, like I said, that I can and cannot take. She wrote me 5 prescriptions, 1 for pain medicine, of course, after surgery, 1 for nausea medication. 1 is a patch that goes behind your ear the night before surgery, and that helps with nausea. And that was my biggest concern. It's not the pain, which I know I'll be in pain. I know that will be there. But the last surgery I had when I was only 18, but I had my gallbladder taken out, which I feel like is going to be pretty similar to this. And my problem was not the pain, even though I had pain. It was nausea, and it was having a problem with my pain medication. So I'm really happy that they gave me nausea medication, which I know they do that. It's pretty standard for all their patients, but I was really happy that they did that. And then I have to start Nystatin Swish and Swallow tomorrow, 7 days before surgery. I think I have to do it twice a day, and you just swish it around and swallow it, and that's to prevent thrush, because that's a common reaction or common complication after, I believe, any surgery, but I assume especially after a digestive system surgery. So we went over all of my medications, just any questions I would have, lots of stuff, pretty standard stuff. And then they sent me down to the hospital. I had a chest x-ray, like I said, and an EKG. Those, I believe, were great. The nurse down there gave me some Hibiclens, which is a little bottle of soap. I forgot to grab it, or I'd show you. And then Saturday, my surgery's on a Monday, so Saturday night, Sunday night, and Monday morning before my surgery, I have to wash from my neck down with that, just kind of in my abdominal area. I have to scrub for 5 minutes, and that's just to get rid of as much surface bacteria as possible. So I got that, got those instructions, and really just went over a lot of last minute things. Like I said, that was my last appointment before surgery, so just got some questions answered, and that's pretty much it. I think that's all of my big updates. I am going to also do a video. I may do it before or after my surgery. I'm not sure, about at least 10 things that I was really surprised about, that I learned from this procedure, or this process, I guess I should say. Little things that just popped up. So I'm definitely going to do that video. So look forward to seeing that, or be watching out for that video pretty soon. I'm not sure when, but that'll be one of my upcoming videos, because there were lots of little things that I was like, really, we can't do that, and we can't do that, you know. So it's kind of shocking. But so stay tuned for that. And like I said, I think that's really all of my updates. I'm really excited about surgery, and anxious, of course, because it's a surgery and I know I'm going to be in pain, but it is what it is. My husband is taking off the week with me, so he'll be home with me. My dad is watching my girls, so they'll be having fun over there, which they love staying over there. So I have a great supportive family all around, my in-laws, my parents, of course, friends. I'm just so blessed to have all of this support, and I really cannot be any more thankful for that support. And I really want to say also that to all of my friends and family and all of you guys out there watching, I'm also so thankful for the lack of judgment with this decision, because I know it's a big deal, and especially within my family, if they were to have any kind of judgmental comments, which I mean, none of them really, they've all been great. If they've said anything, I can tell it comes from concern that, you know, that I really want to make this decision, and I know that it's just because they love me and they want to make sure that I'm making the right decision. And I think that especially this time next year, I think that they'll look back and say, okay, we can see why she did this. Also, I want to say that I almost feel like this big decision that I made for myself has been like a rolling effect for a lot of other people. My husband is starting to, we're cooking at home all the time now because I can't eat out during this pre-op stage. So my husband is like, just every night I'm going to cook at home for the girls. He's a great cook, so he loves to be in the kitchen. I almost never cook, so unless he's working at night. So I'm very blessed with that, because during that pre-op diet class, he was like, oh, I can come up with this idea for a recipe and for this idea. So he's always like, his wheels are spinning about the foods that I can have once I get past the liquid stage. So I'm just so appreciative of that, and the fact that he is willing to make a lot of healthy changes, and not only willing to do it, but happy to do it. And for my girls, and just, you know, it's nice, and I know they're so supportive, so I really want to thank everybody for that. But that's it. I won't keep you guys any longer. I was trying to do a pretty short and sweet, quick update for you guys, but I wanted to cram a lot in there because I know it's been a little while since I've done a video. But if you guys have any other questions, of course, comment down below. Let me know what questions you have, or comments about the upcoming surgery, or anything little things that surprised you about this experience or this process, because I definitely want to do a video, like I said, about that. But yeah, so to all of you that are having surgery coming up soon, I wish you the best of luck, and I will see you guys soon. Thanks again for watching.